Alright, so today discussing the very important topic of Organon of medicine that is always asked in your question paper in the 10 or 20 marks, that is physiotherapeutic measures, and majority of the students don't know meaning what to write, and they even don't understand. So first of all, as you can see, the meaning of the physiotherapeutic measure. What is the meaning of the physiotherapeutic measure? First, you need to understand this. So, even after the medication, patient fails to improve. When the medicine fails, the physiotherapeutic measures come into the role. Or we can say we can use these methods along with the medication so as to give the quick cure, quick recovery and palliation to the patient. Alright. So, these methods are used to arouse the vital force. Alright, when the medicines sometimes fail, or along with the medicine to give the quick relief to the patient, or we can say the palliative relief. Alright, so first method is animal magnetism or mesmerism. Okay, so what does this animal magnetism or mesmerism means? What it means? Alright, so mesmerism simply means we are transferring a power from one person to the another person, but the person should be well intellectual, well intentioned. Alright, so we are transferring the power from the one person to the another person. This is the meaning of the animal magnetism or mesmerism. Okay, so there are two types of mesmerism. What are these two types? Okay, so or we can say what are the two types of the mesmerism. Okay, so two types are, first one is positive and second one is negative. So what is positive and what is negative? Positive simply means when there is a lack of vital force. Okay, and negative simply means when there is excess of vital force. Okay, so lack of vital force and excess of vital force. When there is a lack of vital force, the person does the mesmerism slowly. Alright, so when there is a lack of vital force, what does a person do? The person moves the hand over the body from head to toe slowly. यहाँ पे slowly word जो है वो बहुत ज़्यादा important है. Alright, and when there is an excess of vital force, alright, the person who is doing the mesmerism moves the hand over the body from head to toe fastly. Alright, so this is a major difference between the two types of mesmerism, that is positive and negative. Alright, next is, as I had told you earlier, that the aphorism number is very much important when you are doing any answer, when you are answering any answer of the Organon of medicine. So it is well written in 288 and 289 aphorism of Organon of medicine. Alright, animal magnetism or mesmerism. Next is magnetism. So what does this magnetism means? Magnetism simply means magnet powers we are transferring. Okay, so as we know, the medicines are also prepared from the magnet powers, that is north and the south pole. Alright, north and the south pole is used to prepare the medicine. North pole and south pole. So we have got the medicines also prepared from magnetism, that is Magnetis, Polus, Ambu and Arcticus. Alright, so the poles of the magnet are used to treat. Alright, next is electricity and galvanism. And before talking about the electricity and galvanism, magnetism is mentioned in 287th aphorism. Okay, next is electricity and galvanism. Electricity, dynamic powers of electricity are also used to treat the patient. Okay, and not majorly asked, this is not majorly asked to you that what does electricity, but electricity dynamic powers are also used to treat the patient. There are many medicines prepared from electricity. Electricity. Next is massage. So massage is mentioned in 290 aphorism, and in this the massage is done to increase the blood circulation, to increase the lymph circulation, or to increase the flow of the vital energy in the organism. When the patient is healthy but not gaining weight or any of the thing that renders the patient towards a cure, so the massage is used, and it is mentioned in 290th aphorism. Next is bath. Bath is mentioned in 291 aphorism. Alright, so bath, simply what does it mean? If the patient is drawn, okay, and there is a chilliness of the body after that. Alright, giving a simple example, there is chilliness of the body after that. So what we do, we will give the patient a bath of the lukewarm water. It is like vice versa. What the patient has done, the patient is drawn, body is now chilly or cold. Now we are imparting the opposite temperature onto the body to make it warm. Okay, it is cool, now we are making it warm. So we are doing contradictory. Okay, so this is the bath, and these are the physiotherapeutic measures which are used when the medicines fails to improve the vital reaction. Alright, and it is always asked question. That's why I had made this video for all those students who are asking me again and again about the physiotherapeutic measures. And remember all this. Don't forget to write the aphorism number along with your answers, because it's very important that in which aphorism it is mentioned and always asked. Okay, this is the way you can differentiate yourself from the others who after writing the aphorism. So that's all for today's video. I hope this video is going to be helpful to you. If you find it helpful, please like it and subscribe to our channel. Thanks for watching.